Tomorrow, students at Fletcher High School are expected to return to campus after it was forced to close due to a spike in COVID-19 infections. More than 40 students and several staff caught the virus. Dr. Pauline Rolle is the director of the Duval County Health Department, which conducted contact tracing for the school and does so, we should point out, for all of the public schools in Duval County. Doctor, thanks for joining us.
Good morning. Thank you for having me again.
So when I interviewed Dr. Rolle, the principal at Fletcher, last week, he mentioned that you and your staff were working as quickly as possible to conduct the contact tracing. Have you been able to track down everyone who may have been exposed and been able to notify them?
We think at this point we have. One of the difficulties in this contact tracing that we're finding, having delays in getting the results. Oftentimes families know way before we do, sometimes up to a week before we do, that they have a positive case in their household. And so we've asked people to let us know if they've gotten a positive and they have not heard from us. But we believe we've been able to contact all of those cases at the school at this point.
And I want to make sure I understand what you just said. You mean that there are families who know that their child has tested positive, but they've failed to notify the health department and the school? Can we make that assumption?
Yeah, well, we've seen some delays in terms of the test results getting to us. Those agencies doing testing are required to report those results to us within 24 hours. But unfortunately, that's not happening in a timely manner. And so we've gotten complaints from the community that, oh, my God, it's taking you guys so long to get to us. But some of that is related to the point in time at which we received that positive test result from the testing site. And so it can be up to a week later that we get those results. And that at that time, we will reach out to those families. But certainly if they have not heard from us, we're asking people to contact us in the event that we hadn't received those results.
Yeah, don't make an assumption that you know. Just go ahead and be a great communicator. So when I spoke with you last, and when we heard from you, in fact, during the news conference with Dr. Diana Green, you explained that there were some real challenges and maybe moving forward when it comes to contact tracing in general. Students who might actually not want to be honest about who they've been around because for some reason are worried about being labeled a snitch. Could you explain that? And what is your message then to students?
So we've heard that from both parents and students. And so our message is, please don't be concerned about that. By letting us know that you've been a contact, you're doing the community a service. You're helping us with our tracing so that we can help mitigate the spread or stop the spread of disease in our community. And so, yes, folks have been concerned, oh, I'm going to get in trouble, or this person's going to get in trouble. Please note that when we reach out to your close contacts, they don't know who told us they were a contact. We keep that confidential. And so there's no need for anyone to be afraid to share that information with us. It helps us to be able to let folks know, hey, you've been a contact and you've been exposed to COVID-19, and they can take the necessary precautions to, in the event that they become positive, to prevent the spread of the disease.
It's interesting. You had one person you mentioned to me tell you that it seems like they're being punished for being truthful. That is, there is a real risk to that kind of thinking, and it couldn't be further from the truth.
Yeah. Because, parents are having to take off work, students are out of school. And so to some extent, they feel like it's a prison sentence that they're having to be quarantined. But what I have to explain to folks is this is not a prison sentence. We are helping to protect the community by you staying home. And it doesn't matter that you don't have symptoms. We do know that there are folks who are asymptomatic and are positive for the disease and can spread it. And so folks feel like, oh, if I hadn't have told you that that I have symptoms, or if I hadn't told you that, or if you hadn't found out that I got tested, then I wouldn't be at home. And so we eventually find out about those positive cases. And so folks, no need in folks thinking they can hide, but we want them to be truthful in terms of who they've been in contact with.
And Dr. Rolle, just very briefly, with Douglas Anderson going back on Friday and then, of course, Fletcher tomorrow, did many of these students experience symptoms?
We had a fair number that did experience symptoms, very few who actually had fever. So a lot of them had symptoms that were similar to the flu or to allergies or things of that nature. And so we want people to remember that COVID-19 is a great mimicker. It looks like a lot of other things. It looks like the common cold, looks like flu, it looks like allergies, it looks like migraines. And so we want people to keep that in mind as they go about their daily lives.
Dr. Pauline Rolle joining us from the Duval County Health Department, and I think it's important to note that these students did experience, from what we're hearing then, many of them, symptoms of COVID-19.
Yes.
Thank you for your time.
You're welcome. Thank you.